Hello everyone, this is Yousef.
And I'm Tamila.
I'm a medical doctor.
I'm a nurse.
And this is the Health Innovation Playground, a podcast discussing the transformation and innovation in healthcare.
Perfect. So this is the first episode and I'm super excited.
Very excited. And we hope you enjoy it.
Yes, welcome.
So what this podcast is about, what do you think?
So this podcast, the main idea was to actually bring ideas and innovators all together in healthcare. And I think this is going to be, that's why we called it actually Playground, because we really want to make it a space, let's say, well, it's a virtual space, but innovators in healthcare and us, the users.
Yeah. For me, the idea of the podcast, it started from, I think right now in healthcare, we are in some kind of a revolution with the new technologies, with AI, with technologies in genomics, and the shift of the healthcare from just being reactive. We're no longer focusing on treating diseases. We're focusing on being proactive, on the well-being of the individuals, on being healthy. And this is a shift to a value-based care, or where the patient is healthy and you take care of them throughout their life, not just only when they get sick.
I think it's very important that we shift this concept of medicine in general, that patient in center. But actually, everyone, healthcare, it's so broad from the beginning to the end. And I think there's innovations throughout the healthcare. It's always been, and it's going to continue. And right now, as we know, it's going to be the huge moment in the medical field. I mean, not medical, healthcare field.
Yeah.
And we should understand what is it about, because what's happening, because innovation is always with us. Like right now you were working in the hospital, I'm in the hospital, and I see how it changes.
Mm-hmm. I think what's happening right now, we're having startups popping out every day, offering new solutions, utilizing these new mindsets, these new technologies, this motivation to provide solutions we never had before. And I think these solutions are tackling everything, starting from your health, baseline health, diagnosing a disease, it's changing, treating a disease, follow-up of a disease. We now have new ideas like precision medicine, digital twins, liquid biomarkers. Yeah. I mean, the mindset in medicine is completely changed than the medicine we studied, and it's improving, I would say, and I'm very excited for it. Right?
Exactly, and I think when you said disease, now we shouldn't only focus on disease, but there's others, like life in general. You know, healthcare, it's so integrated in our life right now. And I see people started to understand it. And there's a lot of startups goes to the prevention, not focusing only on disease. So it's also the big field, the preventive.
Yeah, because I think when we wait till you get diseased, it's already too late. It's better to start from earlier. And yeah, from these ideas started the podcast. And tell them, Tamila, how did this podcast idea come to mind? Tell them the story.
So basically, let's come to the beginnings. I met Yousef on the master degree that we started together in Barcelona. And it's a new master. It's a first edition. It's a first course. And everything is so new, right? It's a master about innovation and entrepreneurship in healthcare. And when I saw you asking the questions, because to be honest, I had no expectations for this master. I had some expectation, but I wasn't like, okay, it's a first edition, be chill with them. But really, when they started to invite the guests, the questions came like immediately.
Yeah.
Why? Because we know the problems in actual healthcare in the different countries. Well, you worked in Egypt. I work in Barcelona, so I know more about the healthcare in Barcelona and in Spain. And you just started to ask questions without stopping. And I was like, wow, this guy really knows things about innovation, and he's really curious about how to make it better. So how to make the healthcare better. So I just came in and like, why, do you have a podcast? And you said no, but let's do it. And I go, okay, let's do the podcast. I am happy to do it and help with everything you need for the podcast. So basically the idea came, but they say two minds come together and create something new. So you always need collaborators. You always need a team. So this is how we create a team for the moment. So,
yeah, like I always like to share my ideas, to write them, to share them with people. But if you asked me, would you start a podcast like 2 months ago, I wouldn't have expected. Like we have just started this master in the middle of September, and we're doing it at Vall. And to say a little bit about how we got there, I was working in Egypt as a diagnostic and intervention radiologist. I started a residency there. I stayed for a year, and then I wanted a change. I wanted to grow. I wanted something different. I quit my job and I decided to move to Spain to start this master's. I had no idea about Vall. I had no idea about about the thing called health innovation. But I was intrigued. I was curious, and curious is the word. Like, I'm always curious about stuff. I always want to know more. I always like to unpack more. And I always like to share all of the insights I get, all of the stories I learn. That's why the idea of a podcast is really...
And also we have to say, no? Yeah. And we needed a place and space to express ourselves and also invite people who also think as us and maybe even more than us.
That's what I really like creating a community. To give voice to all the people who are thinking about that. I would really love that to grow as a big community and
help. Right?
Yeah, and diffuse these information, unpack them, simplify them for everyone to listen to it. And starting in Barcelona and Vall,
I think it's a good start.
Why is that special? Why is
it special?
Why is Vall special? Why is Barcelona special right now?
Well, I think in general, like Barcelona, it's a startup center.
Yeah.
Not only in health, but especially in health right now, but also in technology, tech health, everything. And Vall, I don't much, but we got there in this beautiful space of research center. First, it's a world sustainable building. And first, they real research center basically it's a space to create the new innovation solutions and test it directly in the hospital.
Yeah.
So I think it's a new idea and it's a revolutionary.
Yeah.
Because you have the center of ideas, boiling and creating, and you have a space to actually test it.
Yeah.
And I think it's a big privilege.
Yeah.
And we had the CEO of Vall giving us a lecture, an honor.
Sorry.
It's a big honor. And he actually was proud to tell us how they manage hospital right now after COVID, that everything changed with COVID. And it would be transformation in hospital.
It's a very inspiring space. I really encourage the listeners to go on the internet and look at the building, the Vall Research Institute. Just being there and being surrounded by these people, I always longed for that, to learn from people who are much better than me, who can give me a lot of their knowledge. And just being there, it's so inspiring, it's so motivating. And also, I just moved to Barcelona in September. The whole city is really inspiring and really motivating for improving, for change, for innovation. if you have any idea, it helps you.
Exactly.
And it's a very fertile environment for innovations and startups. And in healthcare, I think there has been a very strong focus in the last years with
after
the
COVID.
with the BioCat, with all the different universities here, the biomedical research parks and centers. So I think Barcelona is a really interesting place to launch our podcast. Yeah,
that's true.
It's in the middle of Europe, and I hope we engage with people all over Europe and all over the world.
But also it's a big chance because we are in touch with people, close touch to be honest, thanks to Master, with people who are key actors on the innovative arena here in Barcelona. So that's why we go for it, we start in it.
Yeah. I mean that the guests and the professors who come to teach us, they open up a lot of ideas, and that's where we got excited to start the podcast, like to unpack this more, to share this with other people, and it's very exciting for me.
Yeah, and we are too. Well, we both are not from here. Well, I live here I'm from Kazakhstan and worked here. So I think we can fuse different cultures.
Yeah.
That's important because yesterday I was like news and stuff, and they say why Spain is growing, GDP of Spain is growing so fast, more than in Germany. Well, this is out of topic, but it's important because of immigration.
Yeah.
So this is important that we are different profiles and we can actually compare different healthcare systems also.
Let's talk a little bit about how our background would put some input in this podcast. Like first, tell me about your clinical background.
Yeah, my clinical background, I started with the pharmaceutical science, but I really wanted to be close to people and work in a hospital. I know and didn't know much. And I decided to do nursing science. And I graduated from nursing science like 4 years ago. But there I haven't stopped because I started studying master degree in anesthesia, and I really it changed my career. To be honest, because before infectious after we had a lot of patients with COVID, and I learned a lot. Today, go ahead and start with innovation because every day going to the hospital, it's actually for me a space to try new stuff.
Yeah. And the patients, like really being in the field with the patients, seeing how much they need these innovations, how much impact these new technologies, inventions would change their lives. This is really integral for me. I used to work in a tertiary care center in Egypt, in Ain Shams University Hospital. It's a massive hospital. 10,000 patients a month and lots of doctors working there. We were suffering from low resources, low organizations. When I was there, I always wanted to change things. I always wanted to improve. I faced a lot of challenges, and I just want to be on the front line of changing things. I would love to help these ideas come to market all over the world, and to really design innovations with the patient at the center, For me, this really motivates me. This really makes me wake up every day.
Yes, I think the field we work, we are fortunate to study it, sacrifice, let's say, sometimes we sacrifice our lives, to help others.
Okay, so here we are, a doctor and a nurse chatting together. It reminds me of being in the OR and chatting and...
But normally it's more stressful. It's not chill. We're talking about innovation, healthcare. No, in OR we know this is always a pressure.
Yeah.
Actually, we're gonna do an episode about it, about the managing the hospital and how difficult it is, because we have 2 doors, OR and a main door, CITA. How do you call it?
Consultoria.
We're sorry, but sometimes it's gonna be Spanish going in my vocabulary. So Yeah. So yeah. What do you expect from this podcast?
For me, I think we would like to create a community, a space where we can interview guests and talk with them. Guests who could be doctors, entrepreneurs opening startups that offer new healthcare solutions, scientists, CEOs, leaders in healthcare,
engineers, everyone who is interested in innovation in health, I think should. And it's an open space for conversation.
Yeah.
We don't debate. But we're going to tell you if we can. We will.
And who should listen to us?
Everyone could listen us who is interested in healthcare and I think we don't discriminate because we can't.
I think that we target this podcast. We decided that we want this podcast to be understandable by everyone who would be interested to know what's happening in health. So we don't want it to be too technical. We don't want it to be too medical.
We just want to be curious and ask same questions as you ask. For example, if we don't know something, we just ask. Just like kids, like explain. This is what they say. Like explain me like I'm 12 years old. So
it's a playground. Yeah. We're here to play. We're here to have friendly chats and conversations with everyone. And we will always make sure to simplify all technical terms for everyone to understand it. Of course, this podcast would be very interested to people in the medical field and the healthcare industry. But I hope every single person in the world would be interested in listening to us and would enjoy listening to us.
So too. We're going to have more views and more listeners. But yeah, and if you think you can participate and have a conversation with us, please contact us. We have our own space. So yeah.
And let's create this community.
Yeah.
I hope everyone could reach out to us.
I would say welcome. Just welcome and yeah.
Thank you, and expect us in a couple of weeks with another episode.